actions that Standard Chartered Bank is doing is actually increasing resilience for the health system for your customers by saying that we are here for good. We are here to take care of you, not only for your day-to-day needs, but we are providing you platforms to ensure that when there is that urgent need or emergency need that you didn't anticipate, we are here for good. We are here for you. So you're basically, by building this partnership with AMREF Flying Doctors, you're building the resilience of the health system for your customers, which is a really big advantage.
One of the things that we did when we refreshed our strategy is to ensure that we are constantly consulting customers and clients to understand what do they really need, what are they looking for in a bank. And as Edith alluded to, one of the areas that was really on top was the issue of health. And it wasn't a surprise. But what was revealing to us was how high people rated the matters of health, not only for them personally, but their families and also the people they are close to. That is very, very important. Your bank today is who can you partner with so that you're able to provide solutions to your clients and they can be able to get them what we call the one-stop service from the bank. And we've had some various partnerships. We've partnered with some of the insurance companies so that we can give what we call for your health matters, for funeral rights, for last rights, and for education as well. And now this partnership that we are launching today with AMREF is a culmination of that. It's an addition to what we've got. The issue of health is paramount, is important to a lot of our clients, and especially so now. And we've spent time trying to build this partnership. And most important is we wanted to make sure that the connection, even the members signing up, the members paying up, our clients paying up for the membership, which is $2,000 a year for the evacuation, is all done digitally. Because that's where we are putting a lot of our investment. A lot of our investment is for our retail customers is on mobile phone. That's where most of the banking is being done. So we made sure the integration ensures that if anybody is signing up for this program, they are signing it on up digitally. So it was to make sure that we are solving for the clients and making sure that we are solving for their health needs.
Around universal health coverage, we talk about social insurance. Pool resources for those who can afford to pay for themselves and pool premiums so that when they need care, they are taken care of without having to worry about where the money comes from. But on the other side, the government also does provide for people who can't afford, for the poor. And even now, we know that the government does provide, for example, for secondary school students, for air evacuation in this country. So the reason for this partnership is to ensure that those customers of Standard Chartered Bank in Kenya who may have health insurance but do not have emergency health insurance, it's an extension of health services, that actually you do not just need health services, insurance for health services that you access from hospital, because you may need to be evacuated from one place to another as an emergency, and that can also add your out-of-pocket costs, that because the aircraft are important, that they are expensive to moving you when you need that service. So this provides an opportunity for the customers, for staff, to make sure that they have that extra protection, and therefore they have peace of mind.
Evacuation is for all of us. Everybody, you, me, other guys, and our families, we need evacuation. For the simple reason that if you have an emergency outside town or in a far-flung area and you need to access a medical facility, the easiest way, the quickest way to access a medical facility is going through evacuation. So AMREF Flying Doctors has invested. We've got dedicated aircraft, meaning that these aircraft do nothing else apart from carrying patients from the region, from the counties to Nairobi, from Nairobi to other countries in Africa, and from Africa to Europe and America and even Asia. So air evacuation is for everybody, and it's a critical component of a good health system.